Today, we are also diving into an important topic that affects millions of people worldwide: osteoporosis. So, what exactly is osteoporosis? Simply put, it's a condition where your bones become weak and brittle. This happens when your bone density decreases, making them more prone to fractures. The most common fractures occur in the hip, spine, and wrist. These can lead to serious health issues, including chronic pain, loss of mobility, and even long term disability. Beyond the physical impacts of osteoporosis can also take a toll on your mental health, leading to anxiety, depression, and social isolation. But here's the good news: regular exercise is a powerful tool in the fight against osteoporosis. Let's look at how staying active can help keep your bones strong and healthy together with the next reporters.
Osteoporosis is defined as low bone mineral density caused by altered bone microstructure, ultimately predisposing patients to low impact fragility fractures. These fractures lead to a significant decrease in quality of life with increased morbidity, mortality, and disability. Osteoporosis affects men and women of all races, but white and Asian women, especially older women who are past menopause, are at high risk. Medicines, healthy diet, and weight-bearing exercise can help prevent bone loss or strengthen already weak bones. Over 50% of postmenopausal white women will have an osteoporotic-related fracture. Only 33% of senior women who have a hip fracture will be able to return to independence. In white men, the risk of an osteoporotic fracture is 20%, but 1 year mortality in men who have a hip fracture is twice that of women. You might want to talk to your healthcare provider about osteoporosis if you went through early menopause or took corticosteroids for several months at a time, or if either of your parents had hip fractures. Bone breaks, particularly in the spine or hip, are the most serious complications of osteoporosis. Hip fractures are often caused by a fall and can result in disability and even an increased risk of death within the first year after the injury. In some cases, broken bones in the spine can occur even if you haven't fallen. The bones that make up our spine, called vertebrae, can weaken to the point of collapsing, which can result in back pain, lost height, and
Bone physiology basics. Bone remodeling. Bone remodeling is a dynamic process where old bone is continually broken down by osteoclasts, specialized cells that absorb bone tissue, while new bone is formed by osteoblasts, cells that produce bone matrix. Is an ongoing cycle of bone resorption and formation helps maintain bone strength, repair microdamage, and regulate mineral content. It's crucial for adapting bone structure to changing mechanical demands, repairing injuries, and ensuring proper mineralization. Peak bone mass. Peak bone mass refers to the maximum amount of bone tissue a person typically achieves in early adulthood, usually in their late 20s and early 30s. After reaching peak bone mass, bone resorption, the process of breaking down bone, gradually surpasses bone formation. This imbalance leads to a gradual decline in bone density over time, making bones weaker and increasing the risk of fractures and conditions like osteoporosis later in life. Therefore, it is important to build and maintain optimal bone mass during youth through factors like proper nutrition, weight-bearing exercise, and adequate intake of calcium and vitamin D. Aging and bone loss. As we age, the imbalance between bone resorption and formation intensifies, resulting in gradual reduction in bone density. This age-related bone loss increases the risk of osteoporosis, a condition characterized by fragile bones and increased susceptibility to fractures. Factors such as hormonal changes, decreased physical activity, and inadequate nutrition contribute to this accelerated bone loss with age. Therefore, it's essential for older adults to prioritize bone health through measures like regular weight-bearing exercise, sufficient intake of calcium and vitamin D, and lifestyle modifications to reduce risk factors of osteoporosis.
Let's proceed to mechanisms of exercise in preventing osteoporosis. For mechanical load, high-impact activities like jumping and lifting weights enhance bone strength by increasing bone formation and reducing bone resorption. For hormonal effects, these hormones promote bone growth and reduce bone loss, with resistance training particularly effective in increasing hormone levels and support bone density. For calcium and vitamin D, exercise enhances blood flow and hormonal conditions, facilitating better calcium uptake and utilization, critical for maintaining strong bones.
When it comes to exercise, older adults should aim for a frequency of at least 150 minutes of moderate intensity aerobic activity per week. This can be achieved through 30 minutes of exercises on most days of the week. Alternatively, they can engage in 75 minutes of vigorous intensity aerobic activity spread throughout the week. It is important to note that these recommendations can be divided into smaller bouts of activity, making it more manageable and achievable. Moderate intensity exercise should create a noticeable increase in heart rate and breathing, while still allowing for conversation. Examples include brisk walking, swimming, or cycling. On the other hand, vigorous intensity exercise should lead to a substantial increase in heart rate and breathing, making it difficult to hold a conversation. This includes activities like jogging, aerobic dancing, or playing tennis. Older adults should choose the intensity level that best suits their fitness level and health status, always considering their comfort and safety. Safety should always be a priority when engaging in physical activity. Older adults should consult with their healthcare provider before starting any new exercise program, especially if they have any underlying health conditions. It is crucial to warm up before exercising and cool down afterward to prevent injuries. Listening to the body and recognizing signs of excessive fatigue or pain is essential. Staying hydrated, wearing appropriate footwear, and using necessary assistive devices if needed are additional safety measures to consider. Finally, older adults should choose exercise environments that are well lit, free from hazards, and supportive of their needs. Regular exercise has profound effects on mental health, particularly for older adults. Engaging in physical activity stimulates the release of endorphins, commonly known as feel good hormones, which can enhance mood and reduce symptoms of depression and anxiety. Exercise also promotes better sleep patterns, reduces stress levels, and improves cognitive function. By incorporating exercise into their routine, older adults can experience improved mental well being, greater emotional resilience, and a more positive outlook in life. Exercise provides a wonderful opportunity for older adults to engage in social interactions and combat feelings of loneliness or isolation. Participating in group activities such as fitness classes, walking groups, or team sports foster a sense of belongingness and connection. It also allows individuals to meet new people, make friends, and build a support network. Social engagement through exercise not only offers companionship but also provides a source of motivation, accountability, and enjoyment. By joining others in physical activity, older adults can enhance their overall well being and quality of life.
Role of exercise in bone health. Exercising regularly reduces the rate of bone loss and conserves bone tissue, lowering the risk of fractures. Exercising also reduces the risk of falling. Exercise that is too vigorous may increase the risk of fractures, so see a physiotherapist. So there are three. First is weight-bearing exercises. Examples of weight-bearing exercises include brisk walking and hiking, jogging or running, dancing, jumping rope, hopscotch, tennis, badminton, ping pong, and pickleball, team sports such as basketball, soccer, and volleyball, lastly, stair climbing. Secondly, we have resistance training. This helps prevent osteoporosis by increasing bone density. This type of exercise puts stress onto bones, and in response, the body creates denser bone tissue. It is not possible to completely reverse osteoporosis as the bone density naturally decreases with age. However, exercise may help offset bone loss and slow progression, particularly if a doctor diagnoses the condition early. In a small study from 2022, post-menopausal women with either osteopenia or osteoporosis took part in a 6-month strength training program. This researcher concluded that this appeared to increase bone density. In a clinician guide in the journal Osteoporosis International from 2002, recommends that the people with osteoporosis mix the following types of exercises for the best result. First, we have progressive, resistant training, balance training, back extensor strengthening, core stabilizing exercises, cardiovascular conditioning, and lastly, impact exercise such as jogging. So the third one, the last one is impact activities. High impact exercise involves running and jumping, activities that cause greater impact on joints and on your feet. Low impact involves stepping, walking, and other movements that you don't get your feet pounding against the ground. High impact exercises conclude running or CrossFit.